Dominique.
Ready? Hi, Dr. Tom here. I'm at the first medical doctor EMF conference in the United States right now, and I want to introduce you to Dr. Dominique Bell. This gentleman right here is probably, I would say, one of the world's greatest clinicians in treating EMF disease. And we've been speaking clinically about a lot of different cases in the last couple of days. But before we get into EMF hypersensitivity, I'd like you to tell me a little bit about where your clinic is and how many EMF patients you've treated.
Yes, my clinic is in Paris. I'm retired now, so I was professor of medical oncology before I am treating patients with electromagnetic hypersensitivity. I treated about 2,000 people with electromagnetic hypersensitivity, and I personally examine all these patients and do clinical investigations in addition to the clinical examination.
So you've done both clinical work taking care of these patients, but you've done a great deal of research and published a great deal of research. Yes. And so in this field of EMF sensitivity, patients usually come to us and they tell us that they are sensitive. They have pain in their ear when their cell phone is near it, or they will be driving and they can tell when they're passing a cell tower because they have palpitations. Tell me some of the things that you have observed in seeing thousands and thousands of patients like this.
The early symptoms, clinical symptoms, deal with headache,
Pain in the ear?
Yeah, pain in the ear, and some, dysesthesis, tinnitus, imbalance abnormalities, and dizziness, and the most important symptoms which can occur if there is no early treatment is cognitive defect with loss of immediate memory. So if you go on this with these symptoms, so we have to consider that it may go towards some pre-Alzheimer's state. So it is definitely we should treat these patients as early as possible and make some educational information for the patients. Should avoid any electromagnetic source.
So what you're saying is these patients will come in with pain in the ear or this obvious hypersensitivity, and that they'll have other symptoms that are non-specific, like fatigue or problems with balance. But in your experience, they've progressed on to like what looks like an Alzheimer's.
The symptoms are not specific, that's true, but the association of symptoms is specific. We can identify the disease by by recording the different association of symptoms. So, for example...
So this is very interesting. So it's not just a functional impairment. You think it's actually a disease of internal organs. And you've demonstrated that with your research.
Yes. I think that the clinical examination is not enough. you have to make some biological tests, and the histamine detection in the blood is increased, in 40% of the cases. So it's a very important test and very easy test to make. There are other tests such as, in the urine, the deficiency in melatonin in the urine. So, it's clinical examination. Okay, this is the first way, but it's not enough to make the diagnosis of hypersensitivity. You need to have several tests, including the level determination and the IgE determination. So, and vitamin D deficiency is very common in these patients. Okay, so these different tests are biological tests are very important to do because they can, they are potential target for the treatment.
Yeah.
I don't believe too much to the treatments which are, close to what we call alternative medicine. I don't believe too much. We need to have a science-based approach to make diagnosis of hypersensitivity and treat the patients according to the results that we obtain with the biological test.
Yes, so use scientific basis to target the treatment for the individual patient. Now, a lot was discussed yesterday about redox cycling. Can you say a few words about how important looking for indicators for addressing the redox cycling of these severely affected patients? Redox.
Redox cycling, yes. This is part of the test. 80% in our experience. 80% of people with hypersensitivity bear with some oxidative stress. So the treatment should, in addition to antihistaminics, we should add some antioxidant treatment.
Okay. And would you say that adding both antioxidants and pro-oxidants to increase the cycle, the capacity, the resiliency would be beneficial in most of these people?
When we combine, some natural drugs such as fermented papaya and ginkgo biloba, plus antioxidants, plus antihistaminics, we plus correct vitamin and oligoelement deficiencies that are very frequent also in these patients. We can get 60 to 70% of clinical improvement.
Okay.
So that we have to add to the treatment prevention in the prevention by telling the patient to avoid any electromagnetic source, because we can have some therapeutic impact on the intolerance symptoms, but not on the hypersensitivity itself, because unfortunately it is, to my knowledge, permanent. So we need to add some prevention, anti-electromagnetic field prevention, and this is very common now with closes. When the measure which is very important to do is to put nude feet directly on the earth.
Natural grounding.
Natural grounding. Because this, that take the electric field out of the body.
Very well. And you mentioned also yesterday the crossover of EMF hypersensitivity with multiple chemical sensitivity.
In 35% of the cases, LCS, multiple chemical sensitivity, is associated with PHS. And so we also have to treat LCS. But the treatment is exactly the same, with the same results that can be obtained as for electro hypersensitivity. LCS. There is no difference for the treatment of electro hypersensitivity and multiple chemical sensitivity. But the prevention is not similar. We need to discard any toxic chemicals in the case of MCS. So when the patients have both disorders, the life is very difficult because as far as the prevention is concerned.
Well, Dr. Bell, thank you so much for all of your hard work. Thank you for your words today. I look forward to sharing our cases and our science with each other in the future.
But don't forget that it is imperative to use some science-based tests, biological tests.
Yes.
And to be sure of the diagnosis. In our series, we have about 10% of people who thought that they were electrohypersensitive, but in fact they were not. So very important to have some objective tests.
Thank you.
Yeah,
Thank you so much.
Okay.